Calcaneal apophysitis, also known as Sever's disease, is an inflammation of the growth plate in the heel bone, otherwise known as the calcaneus. It commonly affects children and adolescents who are physically active, typically between the ages of 8 to 15 years old, due to the repetitive stress on the growth plate during physical activities that involve running and jumping. The etiology of the condition is not entirely clear, but it is believed to result from repetitive microtrauma to the area and may also be associated with abnormal biomechanics, such as overpronation. In those children who exhibit a tight heel cord, athletic activity creates tension on the Achilles tendon. This creates tension on the growth plate of the heel bone, and pain may occur. That is why calcaneal apophysitis is also known as traction apophysitis. Symptoms of calcaneal apophysitis typically include pain and tenderness in the heel, especially during physical activities or even just walking, and sometimes swelling. The pain can range from mild to severe and may worsen over time if left untreated. Diagnosis is typically made based on clinical history and physical examination, with imaging studies such as X-rays or MRI being used in severe cases or to rule out other conditions. Treatment options for calcaneal apophysitis typically involve a combination of rest, ice, anti-inflammatory medication such as ibuprofen, and physical therapy exercises to target the muscles and tendons surrounding the heel. If the physician feels the problem is due to excess pronation, an orthotic may be worn to reduce the stress on the growth plate. In more severe cases, immobilization in a cast or walking boot may be necessary. Once the pain has subsided, patients can gradually return to physical activities but should do so gradually and under the guidance of a healthcare provider. Research studies have shown that calcaneal apophysitis is a common condition among children and adolescents who are physically active, with one study finding a prevalence of up to 15% among young athletes. Additionally, one study found that children with flat feet were more likely to develop calcaneal apophysitis. To prevent or manage calcaneal apophysitis, patients and their families should take steps to prevent or address underlying biomechanical issues, such as overpronation or flat feet, through orthotics or physical therapy. Patients should also avoid overloading their heels with physical activity and should gradually increase activity levels as tolerated. Parents should also look at their child's cleats. Athletic shoes, where the cleats are located in the front and back of the shoe, but not the center, tend to allow the child to pronate more, thus exacerbating the problem. Lastly, patients may benefit from cross-training exercises that target different muscle groups and reduce the repetitive strain on the heel. In most cases, this is a self-limiting condition that will resolve over time.